I am Shella Mae Tudio and I'm going to discuss about fluid and electrolyte balance in our body. So, introduction. Water is a primary component of body fluids, is the most abundant substance in the body. Water plays a vital role in several physiologic processes such as digestion, absorption and use of nutrients, distribution, waste excretion and perfusion, and maintenance of hemodynamics. Homeostasis of fluids and electrolytes occurs by complex systems that ensure proper functioning. So, the total body weight of female is 45% of solids and 55% of fluids, while the total body weight of male has 40% solids and 60% fluids. So, the two-thirds intracellular fluid, or the ICF, and the one-third is the extracellular fluid, or the ECF, and 80% interstitial fluid, and 20% plasma. So, the water constitutes an average 50 to 70% of total body weight, young males 60% of total body weight, and older males has 52% of total body weight. So, young females 50% and older females 47%. It has variation of negative or positive 15% in both groups is normal. And obese have 20 to 30% less body water than lean people. And infants, it has 75 to 80%. So gradual physiological loss of body water, it will become 65% at 1 year of age. So there are a lot of sources of body fluids, which are reformed water presents about 2,300 ml per day of daily intake. Metabolic water is produced through the catabolic breakdown of nutrients occurring during cellular respiration. This amount to about 200 ml per day. And combining preform and metabolic water gives us total daily intake of 2,500 ml. So, the fluid compartment, so approximately 62% of the body's fluid is intracellular. So, when we say intracellular, it is located or occurring within a cell. And approximately 30% of the body's fluid is interstitial, which between things that are normally closely spaced. And approximately 8% of the body's fluid is plasma. So that is the fluid compartments. And the functions are: all chemical reactions occur in liquid medium. It is crucial in regulating chemical and bioelectrical distributions within cells. Transport substances such as hormones and nutrients, oxygen transport from lungs to the body cells, carbon dioxide transport in the opposite direction, dilutes toxic substances and waste products and transports them to the kidney and the liver. Distributes heat around the body. And these are the fluid types. So, fluids in the body generally aren't found in pure forms. Isotonic, hypotonic, and hypertonic types, defined in terms of the amount of solute or dissolved substances in the solution. Balancing these fluids involves shifting of fluid, not the solute involved. So, there are 3 types of electrolyte, which is the isotonic, no fluid movement; hypertonic, fluid movement into veins; and hypotonic, fluid movement out of veins. So, the composition of body fluids. Non-electrolytes includes most organic molecules, do not dissociate in water, and carry no net electrical charge. And the electrolytes dissociate in water to ions and include inorganic salts, acid and bases, and some proteins. The major cation in extracellular fluids is sodium and the major anion is chloride. In intracellular fluid, the major cation is potassium, and the major anion is phosphate. Electrolytes are the most abundant solutes in the body fluids, but proteins and some non-electrolytes account for 60 to 97% of dissolved solutes. So, principles of body water distribution. Body control systems regulate ingestion and excretion. Constant total body water, constant total body osmolarity. So, homeostatic mechanism respond to changes in ECF. No receptors directly monitor fluid or electrolyte balance. Respond to changes in plasma, volume, or osmotic concentration. So, the fluid movement of fluids is due to hydrostatic pressure differentials and osmotic pressure differentials. So, these are the movement of body fluids, the diffusion, osmosis, active transport, and filtration. So, in osmosis, high solution concentration, low fluid concentration, and low solute concentration, high fluid concentration. So, makita siya sa picture nga mo ni mahitabo sa osmosis. Next is the diffusion. This part is high solute concentration and low solute concentration. So, mo ni siya ang diffusion. And active transport. Intracellular fluid and extracellular fluid. Next is the filtration. Filtration is the transport of water and dissolved materials through a membrane from an area of higher pressure to an area of lower pressure. So, you see it in the picture. Next is water. 2 liters of water per day are generally sufficient for adults. Most of this minimum intake is usually derived from the water content of food and the water of oxidation. Therefore, it has been estimated that only 500 ml of water needs to be imbibed given normal diet and no increased losses. These sources of water are markedly reduced in patients who are not eating and so much be replaced by maintenance fluids. So, water requirements increase with fever, sweating, burns, tachypnea, surgical drains, polyuria or the excessive urination, or ongoing significant gastrointestinal losses. Fluid balance. The body tries to maintain homeostasis of fluids and electrolytes by regulating volume, solute charge, and osmotic load. Normally, there is a balance achieved between our total daily intake and output of water. So, total fluid intake is modified by the induction of the sensation of thirst. This is produced by a reaction of cells in hypothalamus to increase osmotic pressure of the blood passing through this region. Another stimulus of thirst would be the degree of dryness of the oral mucosa. So, regulation of body water. Any of the following: decreased amount of water in body, increased amount of sodium in the body, increased blood osmolality, and decreased circulating blood volume. It will result in stimulation of osmoreceptors in hypothalamus, release of ADH or the antidiuretic hormone from the posterior pituitary, and increased thirst. Regulation of water intake. The thirst mechanism is triggered by a decrease in plasma osmolarity, which results in a dry mouth and excites the hypothalamic thirst center. Thirst is quenched as the mucosa of the mouth is moistened and continues with distension of the stomach and intestines, resulting in inhibition of the hypothalamic thirst center. Regulation of water output. Drinking is necessary since there is obligatory water loss due to insensible water losses. Beyond obligatory water losses, solute concentration and volume of urine depend on fluid intake. The influence of ADH, or the antidiuretic hormone. The amount of water reabsorbed in the renal collecting duct is proportional to ADH release. When ADH levels are low, most water in the collecting ducts is not reabsorbed, resulting in large quantities of dilute urine. When ADH levels are high, filtered water is reabsorbed, resulting in a lower volume of concentrated urine. And ADH secretion is promoted or inhibited by the hypothalamus in response to changes in solute concentration of extracellular fluid. Large changes in blood volume or pressure or vascular baroreceptors. So, problems of fluid balance. Deficient fluid volume, so these are the problems. Hypovolemia, so when we say hypovolemia, it is abnormally low extracellular fluid in the body. And the dehydration, absence of a sufficient water in the body. And the excess fluid volume, hypervolemia, so this is the opposite of hypovolemia. Water intoxication, and the electrolyte imbalance, deficit or excess of one or more electrolytes. And then the acid-base imbalance. Factors affecting fluid balance. Lifestyle factors, so nutrition, exercise, and stress. So these are the factors that will affect the fluid balance. Next is the physiological factors. Cardiovascular, respiratory, gastrointestinal, renal, integumentary, and trauma. Developmental factors. Infants and children, adolescents and middle-aged adults, older adults. Clinical factors. Surgery, chemotherapy, medication, gastrointestinal intubation, and intravenous therapy. So, next is we're going to tackle about electrolytes. Electrolyte balance, or Na, or sodium predominant extracellular cation, 136 to 145 milliequivalent per liter, pairs with chlorine and hydrogen carbonate to neutralize charge. Most important ion in water balance, important in nerve and muscle function. So that is the importance of Na, or the sodium, in the body. Reabsorption in renal tubule regulated by aldosterone, renin, angiotensin, atrial natriuretic peptide, or the ANP. Electrolyte balance, or K, or potassium, major intracellular cation, 150 to 160 milliequivalent per liter. No, it regulates resting membrane potential, regulates fluid ion balance inside cell, and regulation in kidney through aldosterone and insulin. Electrolyte balance in chloride, or Cl. Major extracellular anion, 150 milliequivalent per liter. It regulates tonicity, reabsorbed in the kidney with sodium. Regulation in the kidney through reabsorption with sodium, reciprocal relationship with bicarbonate. So, sodium homeostasis. Normal dietary intake is 6 to 15 grams per day. Sodium is excreted in urine, stool, and sweat. Urinary losses are tightly regulated by renal mechanisms. And calcium homeostasis, body contains approximately 1,400 grams of calcium. Reduction in calcium level leads to increases calcium reabsorption from the bone. It increases calcium reabsorption and stimulates the formation of the active metabolite of vitamin D that increases gut reabsorption of elemental calcium and facilitates the action on the bone. phosphate homeostasis. Dietary intake 800 to 1,000 milligrams per day, reabsorbed in the jejunum. Kidney acts the principal regulator. Normal serum P conclude is 2.5 to 4.5 milligrams per deciliter. Electrolyte disorders, signs and symptoms. So, sodium excess, it will cause hypernatremia, thirst, CNS deterioration, increase interstitial fluid and deficit, hyponatremia, CNS deterioration. Potassium excess in electrolyte, that it will cause hyperkalemia, ventricular fibrillation, ECG changes, CNS changes or the central nervous system, hypokalemia, bradycardia, ECG changes, CNS changes. In calcium, hypercalcemia, thirst, CNS deterioration, increased interstitial fluid, and in deficit, hypocalcemia, tetany, chavostic stenosis, signs, muscle twitching, CNS changes, ECG changes. And magnesium, hypermagnesemia, loss of deep tendon reflexes or the DTRs, depression of CNS, depression of neuromuscular function, and hypomagnesemia, hyperactive DTRs, and CNS changes. So that is the sign and symptoms if the electrolytes may excess or deficit. So that's all about electrolyte disorders. So that's all. Thank you.